Thank you for joining us this evening. I'm Rhonda Heights with the Munroe-Meyer Institute, and today we're going to be visiting about the new Nebraska electronic visit verification, or the EVV, for services. Just a little bit about our program, and if you've been here before, you've probably heard my spiel before, but in case you're new, I'm part of the Family Care Enhancement Program at MMI, which our parent resource coordinators are both in Omaha and around the state. We're parents of children with disabilities or special healthcare needs, and we provide services and help families get connected and navigate to different systems. This is just a quick look at our team. We've got locations in Kearney, Lincoln, Norfolk, Omaha, and future locations in Gering and Scottsbluff. We're kind of looking to expand in those areas. So a couple of housekeeping items for tonight. We are recording these sessions and they are available once I'm able to get them edited on the MMI's information library that we have. So here's the link for that. We also ask that everyone please keep your computer muted throughout the session just because it's easier and we won't have people talking over each other. So any questions that you may have, please submit those to Jennifer Hansen in the chat. And then she will go ahead and get those to our presenters towards the end of our presentation. And at the end, we also have a poll that we would like to just get some feedback as to how helpful the session was. If you have any other ideas or other suggestions, if there's basically just to kind of let us know if we're hitting the mark and if this is something that is helpful for families. So tonight, we are very excited to have several members of the team from the Nebraska Department of Health and Human Services to visit with us about the new electronic visit verification program. And I'm going to go ahead and turn this over to Karen. I'll stop sharing my screen here and let you guys go ahead and introduce your team.
Sure. My name is Karen Hausman. I'm program manager for the Aged and Disabled Waiver. And Becky, go ahead and introduce yourself.
Good evening. My name is Becky Hoffman. I am a program specialist for the Aged and Disabled Medicaid Waiver Program.
Sarah?
Sarah, would you want to introduce yourself? And I can go.
Sorry, I had some interference on my side. My name is Sarah Hendricks. I'm a policy program specialist with the Developmental Disabilities Waivers in our central office.
Thank you. And my name is Jen DeBoer, and I'm the electronic visit verification community, the communications lead. And it's a pleasure being here. And I just also want to say that in my previous lives, I have also been working with the Medicaid providers and also especially with the social determinants of health with disability and also with disability and as well as people with challenges, in their abilities for public health as well. So it's a pleasure and hoping that I can actually do a presentation for all of you. Thank you. So maybe we should begin, Rhonda. What do you think? Great. So let me just share my screen. So can everyone see me and see my screen especially? Perfect. And I know that Rhonda is actually nodding her head. So I'm just going to put this in this mode. Great. So welcome to the electronic visit verification, especially for the state of Nebraska. So for the agenda today, why did the state implement the electronic visit verification? Information about the weekly EVV meetings, who to contact with questions as it relates to DHHS or Telus, What is the info for these contacts? What are the informations that, and where can you get them? What assistance can services coordinators be for families? What will happen if people don't use EVV? Will there be consequences? What if people are struggling with technology? Is there assistance or any alternative? Last but not least, is there differences required for independent providers versus agencies versus family caregivers? So I'm going to breeze through some of the drier topics, which I know that everybody is quite familiar with, which is the 21st Century Cures Act. So the 21st Century Cures Act is a huge, array of mandates that actually has been jam-packed into this act. Part of the act actually discusses, the electronic visit verification, and we're teasing this out so that you know where these acts are. And under section 12006A is where the EVV, electronic visit verification for all the Medicaid personal care assistance program, home health services programs are all in requirements for electronic visit verification. And if you would like to actually read more in details of the 21st Century Cures Act, we're happy after this meeting to send you the entire act. So for next slide. And you hear a lot about what the electronic visit verification and also what the electronic visit verification system is and how it's being designed, and why it's being designed this way is not a coincidence. So there are actually federal requirements to this design. And in order to actually meet the design, the electronic visit verification must meet these following informations and capture these informations. For example, in an EVV system or a solution, that solution must capture the date of service, capture the location of service, capture the time of service begins and ends, identity of the person providing the service, identity of the person receiving the service, and also the type of service provided. So this is how, if a vendor were to design their system, all these must be included in their solution so that they can actually be called an electronic visit verification solution. So in Nebraska, the electronic visit verification, what are the mandates? The mandates are the personal assistance services, developmental disability, the DD waiver, and as well as the aged and disabled waiver services. Federal guidance regarding living caregivers are EVV requirements do not apply when the caregivers providing the services and the Medicaid participant live together. So I'm actually pulling out the federal guidance for you. And also, whereas for the states, they're still responsible to curb fraud, waste, and abuse, even though the federal requirement states that for living caregivers, they may not need to actually be in adherence to the EVV requirements. To that end, to curb fraud, waste, and abuse, Nebraska chose to include the EVV requirement for live-in caregivers. And what are the mandated services for Nebraska? There are 12 service codes, and I don't want to go through all of them, but this slides and this deck of slide is able to be shared to you, and you are able to actually walk them through. So these are the 12 service codes that you are able to see, and they are all mandated for EVV use. So if you do bill under any of these codes, please be remembered that this is where EVV is being used. What are the alternatives to EVV? Special consideration will be given to providers who request for interactive voice response and what we call IVR. What IVR needs is the consent of the Medicaid participants to use their landline for EVV, and also the special exception from DHHS to use IVR. And this special exception is a yearly request that must be made to our DHHS staff. And I want to also, just as a side note, if you don't know what an interactive voice response is, let's give you a really good example. If you were to call your bank on an online banking solution, you dial a 1-800 number. And they will say, if you want to check your savings account, press 1. Check your checking account, press 2. And that is actually an interactive voice response. And I also know that a lot of folks are also asking about computer and digital literacy resources. So on the EVV website, which we will actually be showing you where the website is if you do not know or if you're not familiar, is that we have recently posted some resources links to the website so that providers are able to visit those websites and also to see what those websites can offer to improve their computer and also the digital literacy. Now, we want to also give you a disclaimer. The resource links that are not actually created and supported by any of our DHHS resource developers. Neither are they also supported by service coordinators and also social service workers. DHHS staff do not provide computer literacy guidance and assistance to providers. So be sure to check your local community for other available resources regarding computer literacy training. We want to remind you the last day to submit paper claims. Paper claims with dates of service on or after January 31st will be returned to the provider with a denial letter stating that the claims will not be paid and that the provider must now use the EVV solution. DHHS has turned off paper billing documents. Providers do not wish to use EVV to perform services, may choose to perform services that are not EVV mandated. So as you can see just now, there are about 12 service codes that are EVV mandated. You're able to choose not to provide services for those 12 services, so you do not need to use EVV. And also request another provider to take the performance of EVV mandated services. So if you're uncomfortable using EVV, and we definitely honor and respect that, you can also request for another provider to take the performance of the EVV mandated services. Or, and we definitely do not want you to do this, is request termination of provider services with DHHS. And I understand that the living caregivers and the applicability of EVV requirements is a very hot topic. So DHHS has decided to include all caregivers under the EVV mandate. This decision was not made, simply and easy, but this decision was made with a lot of thought and consideration. So the decision was made to ensure the safety of the program participants, who often receive their services in secluded settings. The EVV system will verify the delivery of services to all program participants. And also, providers must submit claims that are true, they're accurate, and complete. We actually do have a provider bulletin, being published And we will also be sending you that link so that you may be aware and also read through the provider public bulletin as well. So I know that a lot of people may have already been using EVV, and this is the provider registration. And I want to first reacquaint you, if you have yet to begin using EVV, is that before provider starts using Telus EVV, you must register to receive your username and temporary password. And I think a lot of the providers, the initial take on how to register was a hurdle. And so we went online and did a lot of stakeholder meetings and even inform our providers using the provider toolkit to show them in a very simple, easy to understand and access, way to receive their username and also temporary password. And if you can see on this screen, you'll see that there's a link. Here it says fortelus.com/Nebraska-DHHS-registration. Once you click on that, you will actually see this screen. It says provider text ID. What that is, if you're an independent provider, is your social security number. Your payer provider ID, and that is actually your Medicaid or organization ID number. And your zip code, it's your address, zip code. And click on I am not a robot, and then submit. Once you click on submit, that's actually going to be another page. And it will ask you for, your email, your name, and then press submit again. And what will happen is that you will then be, waiting for, Telus to send you a username and a temporary password. And that usually takes about maybe a minute or two. And we often tell our providers, please check your spam box or your junk mail, because sometimes they do end up being there. Most of our providers have a very successful registration experience. Now, we also need to register on the smartphone or a smart tablet. And if you are using Google, Android, Pixel, Samsung, any of those, you go to the Google Play Store, download the Telus mobile app, which you can see here is search for Telus EVV Plus, and you can actually see this icon here and you download them. And if you're using Apple, you go to the Apple App Store, same thing, do a search for Telus EVV Plus, and you are able to locate this icon here and you download them. Once you download it, it will actually present you with this screen. Username is the same username that you use for the admin portal, which you just registered on your computer. The password is also the same password that you use when you actually registered on the admin portal. You logged in, and that's how you actually start. A lot more of this information can be found in the provider toolkit, and we will direct you to that toolkit if you do not have them right now. So, Telus training materials. Where can you find them? And what is this picture here that you have actually shown us? And if you are not familiar, and I'm quite sure many of you who have actually already started using EVV are very familiar to this screen. This is the Telus admin portal. If you're an independent providers, you will land up here after you have registered, after you have put in your username and also your password. And when we say please also, if you are still unfamiliar or a little less confident of using Telus, you can actually get some training and even short snippets of videos, of Telus training materials, in the admin portal. And where are they located? A lot of our providers usually ask. And I want to show you where they're located. And if you see on the dashboard, you'll see that's schedules, you see visits, work list. And as you go all the way down, after settings is training, click on that. This is the training tab. Click on that. And there's an array of training information, training materials, and small snippets of video vignettes so that you may actually watch them. And the vignettes are probably about 15 to 30 minutes, even less, some of them. So if you have an opportunity, please visit the training vignettes because they're extremely useful. So for the Evv Project Updates, we do have a lot of provider guides, that assist, your success of using Telus solution. And if you don't know where those guides are, is actually on the Evv website. And on the Evv website, go and scroll down to the Provider Toolkit section. And on the Toolkit section, you will see a library of materials that you can choose from, pick, and read. And they are not very tedious because they are step-by-step. They are reader-centric. And we also want to capture, the essence of, our own Nebraska provider. So it's actually tailored very specifically to Nebraska. So it's not tailored for, anyone who uses Telus, but in fact, a lot of these are tailored for Nebraska. And I know that a couple of you may also be interested in finding out what are the tentative date for home health services that will also be utilizing Evv. And that is tentatively, slated for January 1st of 2023. And perhaps we may actually be extended if we also apply for the good faith exemptions as well. So stay tuned because, there may be upcoming, informations for you all. When to contact DHHS. If you are using the Telus admin portal and also using cell phones to log in and log out, you would know that you also still need a service authorization. When you are first trying to use the service auth, if you do not see a service authorization in your admin portal, or that you found out that your service authorization has expired and there's no new service auth, you may contact your service coordinator for the waiver programs. And for the past program, please contact Access Nebraska. They will sure to help you. Now, with regarding to, claims issues, if you submit if you used to submit paper billing documents through the leagues or through the AAAs, then you should continue to contact your service coordinator or your resource developer. The claims department for Lincoln DHHS office phone number is 402-471-0667, and you can actually ask to speak to a billing clerk. The email is below, and this deck is also being able to share it with you. So I would not read that, just in case, it may be wrong. So why, as I'm reading it, so you may actually copy and paste that into your email, and you can actually send, the email if you are facing any claims issues. Now, there are also technical issues that some of you may have faced using the Telus app. The Telus Help Desk is available 8 a.m. to 6 p.m. Central Time, and the phone number is 5587. I want to also provide you an insight that all this information can be found right at the EVV website as well. And if you prefer to actually have a live chat, for Telus.com, you would also see a little live chat that's been popped up, and you can chat with them too. I know that a lot of our providers actually do enjoy the live chat. And last but not least, one of the most effective way for you to actually do a self-service open ticket is to go onto the fortelus.com website. And if you scroll down, you'll see a little box that says Open Support Ticket. Click on that, and you can fill out your information, your name, your email address, your phone number if you wish to, and also, write down what you encounter, what's your issue when you're using the EVV portal or, the cell phones, the app, so that, you can put down more, the more information you put down on the ticket system, the better it is, so that when Telus, were to reach out to you, they usually would get to know, how to resolve the issue, sooner than later. And we would usually encourage our providers to give as much information and preferably even screenshots. Last but not least, you should always, if you think that there's informations or issues or feedback that you would like, or even complaints, you would like to actually discuss with the EVV project team, the email box address is below. And I'm sure that you are all familiar because this has been published everywhere, including the stakeholder meeting and the most recent provider support meetings on Wednesdays and Thursdays. So, about the weekly provider support meeting that I just spoke of. The overarching purpose of the weekly provider support meeting is really to discuss some of the issues that our providers, agencies, and independent providers, have encountered. And sometimes there were no ways for them to actually discuss this openly. And because we want this to be transparent to everyone. And also we want all our providers to have a sense of shared community because, as you know, in the time of pandemic, many may not be able to sit together and discuss their issues together. This is a really good way for all of you, including the state staff and also the vendor, to get together and work in a collaborative method to resolve some of the hard to solve issues, or maybe some accolades that we all deservingly, sort of pat each other on the back and say, you did a great job, or thank you very much for helping us resolve certain issues or identify issues, for the states. The weekly agency and independent provider support call is really dedicated to you all, the providers, and also to provide EVV updates, and also to work through some of these hard issues that providers have experienced using the EVV application. And it will end in the end of February. But as of now, if you are interested in participating in the weekly provider support meeting, for agency providers, it's every Wednesday. And for independent providers, it's every Thursday. Slide decks and recordings can be found on the EVV website. We want to remind you again, last day to submit paper claims is that the paper claims with the date of services on or before 30th of January will still be processed in a normal paper process. So if you were to submit your paper claim before January 30th into your SC or to your RD workers, they will submit them and it will be processed and you will get paid. When claims are received with dates of services on or after January 3rd of 2021, letters will also be sent out to providers just to remind you all that please do remember that, papers will be turning off on January 31st. Please, start practicing, using Telus, start using Telus, and, let your muscle memory begin to work. And I want to also remind you that paper claims with data services on or after January 31st will be returned to the provider with a denial letter that the claims will not be paid, and that the provider must now use EVV solution. So just be aware of that. And of course, there are special exceptions. So I don't want everyone to, be anxious about that, and that exceptions, and exceptions can actually be made. I know that later on when questions and answer sessions, our subject matter experts on the panel will discuss more with you. To learn more about EVV, please contact us. And last but not least, if you want to have a better experience using the admin portal and even using the smartphone or tablet, use the latest version of Chrome, Edge, Safari, or Firefox for better viewing experience. And these are all the links that you may actually receive. Click on them. Hopefully you would actually like this, and you may enjoy, using EVV in the near future. And as of now, I want to actually return back the floor to our subject matter experts here on the panel. Thank you.
Thank you, Jen. I did want to just follow up with one question, and I might be getting a little bit ahead of myself. I know we've got a lot of families and caregivers on this call, this meeting this evening, and I'm wondering if you or any of the other panelists are able to speak to what that looks like for someone who's receiving those services and how they would be interacting with the Telus system.
So I can go ahead and take that one, and then if I miss any talking points, my colleagues are welcome to speak up. So as someone who's receiving services, the intent is that there'd be minimal impact for the recipient, the participant. Should I call it parent and child? Is that mostly who's on this call?
I would say probably the majority of individuals on this call are probably parents, but I may be speaking out of turn. But I would say the majority of them would be parents or caregivers.
So the provider will have scheduled a visit in the system. The way the Telus system works is a visit has to be scheduled ahead of time, and then they're able to clock in once they arrive. At the end, I'm going to hold my phone. Maybe that'll help me. So they'll clock in, and then they can set down their phone and do their job. And at the end of the visit, at the end of the time that they're caring for your child, then they just pick up the phone again, open the app to clock out, and there will be a place for the parent or recipient to sign off with their finger on the phone. If for some reason a signature cannot be captured, sometimes stuff happens, that will still be okay. And then the provider will just have to document why a signature, they might have to document why a signature wasn't gathered. But that's how it works. Did I miss anything?
No, that's really good.
Thank you.
And I think one of the things that we want to also piggyback off is that before you start your visits, always schedule your first schedule on the admin portal. So I think a lot of the providers assume that when they registered, put their username and their password in, when they go into the admin portal, they will actually see all their schedules in there. No, so one of the things that's a misnomer is that you actually have to go in there and you have to actually schedule your visits. Once you schedule your visits on the admin portal for the very first time, then use your phone And thereafter, your phone can do anything and everything for you.
So we can go ahead and open it up to questions and answers at this point.
Okay, it looks like we just have one question so far, and that is, if you live with the recipient, do you still need to schedule an appointment?
So there is flexibility built into that, and the care that you're providing should be, at the same level, same increments that you were doing previously. But the Telus application does want a visit to be scheduled in order to use that clock-in function. And I don't know how to elaborate on that anymore, other than that's how the system that we have is built to work.
Okay, thank you. That was our only question. Just a reminder, if anybody has any other questions, just send them to me, Jennifer Hansen, in the chat.
Jen, I did have another question too. I was wondering, you mentioned a couple of times about the PowerPoint stack being available. Is there somewhere specific you have an email or a web address where we can find that? Or is that something that you can send to me and then I can send out to our participants for this evening?
Yes, you can. I can send it to you.
Okay.
Yeah, through Karen, and Karen can forward that to you. Yeah.
Okay, sounds great. And then I'll send that out to everybody.
And in the very last slide, you will see that there's actually an EVV, website. On the EVV website, you will see a slew of things, available as well. So in terms of what is upcoming, what is the library of guides are there, and also, what are the things that, have posted before, such as the stakeholder meetings as well. So everything is actually on the EVV website, and it's actually very simple to maneuver.
And so it sounds like, if I'm understanding this correctly, a participant, whether that be an individual or a caregiver, basically all that's required of them is to do some sort of a signature, and that is the verification. As far as like a family member is concerned, that's as much interaction as they would have.
Yes, so that is the interaction they would have in regards to how they would verify services are provided. When, of course, they also have a relationship with a service coordinator, and the service coordinator may ask follow-up questions like, how's your care going? How's the visit going? So there's that interaction as well. But in regards to using EVV and the Telus app, that is really the only interaction that the family would have.
I do have a few more questions that just came in. How flexible are the schedules for live-in parent caregivers? If we have to schedule our time in advance and then our plans change, is the app easily able to adapt the changes, or how far in advance must we enter the schedule?
So as Telus has given presentations to us, they have said that it's very important to schedule that first visit on the website in order to link the participant to the service authorization. And if the schedule is going to be changed pretty often, I do recommend having Wi-Fi or internet capabilities turned on, so that way the system can communicate. In regards to ease of use, we've received mixed reviews, but they could be changed right before the session. And Becky, I don't know if you have more details you want to share.
So I've talked to a lot of live-in caregivers, and they voiced some flexibility in the they don't know if the person is going to wake up at 9 a.m. or 8 a.m. So what I usually recommend to them is schedule it to begin at the time that they typically wake up. With the Telus system, there is a 2-hour window. So if you schedule it at 9 a.m. and they happen to wake up at 7 a.m. and that's when you're going to start, you can clock in there, then can go about doing your normal daily routine as a caregiver, and then clock out when you're done. There is the 2-hour window, so you can clock in 2 hours before or 2 hours after that scheduled start time. If for some reason things change and it's completely outside of that window, you can always go in and add a visit. You can do that in the administrator portal, and you would just go in and manually enter a visit and enter why it didn't get scheduled before. You would have to enter a reason code and just put, change of plans, whatever the reason was. So there is flexibility in the system too for those unplanned circumstances.
Okay, I guess we have kind of going off of that. I've learned to schedule a day's visit that morning and hope nothing changes. But if we end a visit to send our son to school and then he gets sick and we have to pick him up, do we have to quickly add a visit before we get him?
Ideally, you would want to add that. But again, if, you don't have time, which, is understandable, then you can go in and manually enter that visit.
Okay, that's all I have for questions right now.
So if a parent or a caregiver does have any questions about that they would maybe then address that with their service coordinators, unless they're also acting as an independent provider, essentially. Is that correct?
Yeah, they would want to talk to, if just a parent, talk to their service coordinator. If it's a provider that has questions, the provider would want to reach out to their resource development worker, unless they are a provider through the League of Human Dignity. Then a lot of times the service coordinator also serves the resource development function.
Okay.
We did have one quick one come in. What if we forget to clock in or clock out? Can we go back and modify the times?
Yes, you definitely can. The system will mark that visit as unmatched because it recognizes that something is missing. When they go into the visit, there's a little pencil next to all the fields that can be edited, and the clock in, clock out time can be edited, and then you would want to enter the reason code for why that was being edited.
I want to also just, reiterate, I know that maybe perhaps tonight there might be, some questions that may have been answered, or other questions that maybe after, tonight, you may actually think about it. So there is, an avenue for you to actually get all your questions, answered, which is the provider support, which is on Thursday and Central Time, 1 to 2:30 p.m. And that is where you can actually not only see the demos of some of the issues being resolved, and also, how Telus is also going to walk you through and teach you how to resolve some of the technical issues that you may be seeing in your clock in and clock out. And as well as, we actually do have a lengthy Q&A sessions, and Karen, Becky, and all of them are also there to actually respond to all your questions as well. So those are areas where you're able to actually get, a full gamut of your response, down from providers' issues to policy questions.
I did have a comment come in just now. I recommend setting alarms on your phone to remind yourself to clock in and out after you set a day schedule. That's what this individual does. And then will the service authorization have a specific description and hours of service daily to be approved?
So Rhonda, your audio's kind of fading out a little bit. I don't know if it's background noise, but I did catch your question. The question was, does the service authorization have it down specifically to the daily schedule? So the service authorizations will look similar or the same as how they look today. And there is flexibility for the participant, their family, to create their week with that provider. I'm trying to avoid using the word schedule since we're talking about scheduling within EVV. But there is, now I have to say that with caution because there's some rules that go along with that. For example, the extra care for children with disabilities, often called disability-related child care, that can only be used in certain circumstances. But depending on the service and depending on the need of the participant, some of those are between the participant and the provider to allow choice, as long as it's within the regulatory rules on the service that can be provided.
Great, thank you. Do we have any other questions for our panel here this evening?
We do. We've got one. They just keep coming in. Does the EVV system provide information on what visits have been paid, or will that still come from DHHS?
So I'm going to let Becky and Jen comment on what the claims console looks like within the EVV Telus system. I recommend that when it comes to reconciling the finances as a provider, to go off of the explanation of benefits that come in the mail, because the system that prints those records is the system of record in regards to the claims that are paid. So that's my recommendation, but I'll hand this over.
Becky, would you like me to first go and then you can piggyback off of that?
Yes, please.
So if you are not aware, in our claims console, we have several status. The status is submitted, accepted, and as well as paid. So in that order, you will actually see that they're submitted, and then is when you actually say, I'm going to release my claims. Once I release my claims, when I go to the claims console, it will say submitted, and then there's a accepted status, and then there's also a paid status. Now, a lot of the providers would usually call us and said, I know it's being paid, but why is it that when I go into my bank or my financial institution, I don't see the money in there? It does take, up to 5 days, and it's not, from the DHX side. So it's actually up to your financial institution to post the payment. And so some financial institution, if it's a first payment from somewhere else, it might take a little while because they need to hold it just in case, it's something that, they don't know where it's coming from. And, once this has been familiar, transaction, your financial institution might actually, post this, sooner than later. So you will be seeing that. And I also want to preface that, we are trying, we as in DHHS and as well as Telus are trying to improve on the user experience. We understand that sometimes our claims, are not being received, or we're not being paid, as providers. And so a lot of the providers have actually given us some really good feedback in telling us that, is there a way for us to know whether, our claims are either errored out of NFocus, or is there a way for us to know that, I have submitted my claims, but there are some issues and I need to go back and actually work on those issues and resubmit those claims. So coming attractions or coming releases, hopefully in the near future, is that, there's going to be some very good user experience coming forward, whereby you will actually be able to see, that if your claims are either error out of, the NFocus system, which is the Telus system, and NFocus is actually the system for which DHHS will accept all your claims, or actually, work your claims and say, it's not that good enough, you maybe have to go back because, something is amiss in your claims. And so there will actually be some status, updates to actually reflect whether your claims have been, accepted by NFocus or been error out of NFocus. So that's some things that is actually coming in terms of user experience that you can actually count on. Becky, do you have anything else to add?
I just have one comment before we move on. So thank you for that explanation, Jen. I just wanted to clarify that the relationship with DHHS and whatever bank you have set up, there will be no change in that. So there shouldn't be any interruption to your financial institution. But go ahead, Becky.
Okay, I just wanted to add that in regards to the amount that is shown in Telus, that is the amount that your claims would total prior to any deductions. So if there is a share of cost, a parental portion, if you owe money for an overpayment, and then FICA, those deductions, those all come out once the claim gets to NFocus. So the amount that is in NFocus is the correct amount, because tell us that we don't communicate any withholdings with them. As Karen said, the explanation of payment will have all of that on there, so that is the correct amount. In regards to the share of costs and the parental portion pieces, you won't enter that in Telus. You'll just, Telus will have the rate prior to any deductions. If you're a client that needs, or if you're a provider that needs to collect a share cost or parental portion from the client or the parent, then you will submit a supplemental form to DHHS that shows that amount has been paid, and then DHHS will release the remainder. So, so just keep in mind that those deductions don't show up in Telus. And if you submit a claim and you haven't submitted proof that the share cost or the parental portion has been paid to you as the provider, somebody from the claims team will reach out to you with the form saying, we need you to fill this out so we can release your portion, or the portion that DHHS owes you for this claim. As far as claim submission, you will want to submit your claims on, if you submit them by Monday night of each week, Monday at midnight, then they are sent to Telus or they're sent to NFocus on Tuesday mornings for payments. As long as NFocus accepts those, they will pay out later that week, unless there's a share of cost or parental portion that they have to wait for that supplemental form. So that's a lot of information, but ideally, most claims can be paid out that same week if you submit them by midnight on Monday. And then if you don't get payment later that week, then there's likely something that needs to be done, or as far as the extra forms, or a correction needs to be made to the claim so it can be paid.
I don't have any further questions at this time.
I do have one more that has come through, but I'm not exactly sure. So I'll just go ahead and see if I can get some clarification. If there is an error on the claim, how long will the turnaround be for the provider to receive? And then that was the end of the question. So I'd asked Karen if she could just clarify that a little bit for me.
Karen in the audience or Karen the presenter?
Karen in the audience. Sorry, I did not specify there. Yes, the question that came through. Because I'm not sure I understand the question. And I just want to try to get that answer for her.
I think I get what she's getting at, though.
Okay.
Here's my great answer of it depends. So if the error is occurring in the Telus system and it's a matching error, then you're prevented from sending the claim to DHHS for payment. So that we wouldn't even know you're sending us the claim. So, well, we wouldn't have received the claim. So that would be a delay. In regards to DHHS receives the claim and then an error is discovered, I believe, and Becky, you can refresh my memory on this. I believe the process is that the billing team sends you notification through the mail that a claim was rejected or that it didn't work, if we're not already working with you directly. So go ahead, Becky.
Yes, that is, if the claim is unable to be brought into NFocus to be paid out, it goes to a separate report that the claims team works on, and they will contact you through the mail and let you know what claim was unable to be processed and what needs to be done to fix that so it can be processed.
So the claims team at DHHS, they work on a first come, first served basis. So it depends on when you respond to the letter. There's too many variables for me to give you a concrete answer. So I apologize for that.
It looks like maybe Karen did send me a little bit of clarification, Karen from the audience, that once the communication is sent out to the provider, how long do they have then to make whatever corrections? And maybe that also depends as well, but is there sort of like a general guideline?
I actually can answer some of it because it depends on also whether or not this is a technology related issue. So as of recently, there are, and full disclosure and transparency, there are some claims issues and, due to systems, technology issues. And for that matter, providers, because are unable to know whether or not their claims are rejected or their claims are actually being error out, what will happen is that when the billing team notify them and speak to them, and if they do see that on their edits and errored comments, because they can go to their work list and under the work list, it will say match or unmatched. If it's unmatched, they can go all the way down, scroll all the way down to the list, and they can actually see edits and also errors. And it will actually tell you what are the issues. And you can actually mitigate that yourself. And if you do mitigate that yourself, once it flips from unmatched to match, you can actually then submit and release your claims. So those are, really on on a one-on-one basis, and the communication has actually been sent out. If there is a widespread of, system issues, then Telus, as a good partner to us, will actually do a data fix to actually sort of, help our providers by fixing everything. And if this is a one-off or two-offs, what we will do is that we will actually send out guidance to how you fix this yourself. One of which is actually what they call the duplicate claims. And if you know what a duplicate claims is that a lot of our providers forgot to submit the entire service, date of service claims in one release. So sometimes you have services provided in the morning, afternoon, and evening. And if morning and afternoon claims are matched, a lot of providers are really excited and they just, release them. And they forgot that that's actually an evening claims that is not matched. And so if they were to attempt to submit that evening claims the next day or a few hours later, that claim is actually going to be errored out. And a lot of providers did call us and say, what happened to my other claims? And so we decided to actually put out a guide, which is the adjusting, duplicate claim guide, which can be found also on the Evv website under the provider toolkit. And there is a very simple step-by-step way for our providers to actually know how to remediate that and then submit that, and you will actually get paid as well. So all these things can actually be done, in more of a self-directed way.
I'll get back to that question that was asked. Jen, thank you so much for sharing that information about the Telus system. Jen made a great point, and I just want to re-emphasize it. If you have multiple clock in and clock outs in one day, release them all together at the same time to Telus. Otherwise, there's going to be some duplicate claim issues. So do the whole day at one time, and that'll prevent some headaches later on. So I wanted to reiterate that. So going back to the question that was asked, the question was, if you get a letter in the mail regarding a claim that couldn't be paid because it's rejected, how long do you have to respond to that? And Becky and I were discussing it offline here, and I don't know the regulation off the top of my head, so I'm so sorry. Because I said, is it 30 days? And Becky said, well, I don't know, is it 90 days? But my point is there's a misconception that you only have 2 days or 7 days or some very short time frame to reply, and that's not accurate. It's a little bit longer. But I apologize, my claims person isn't on the call to answer that question.
Typically, claims need to be submitted within 90 days of the service date, and that's what's in your the provider addendum that you sign each year with your resource development worker.
Okay, well, it kind of sounds like we might be at a point where it's last call for questions. Any other burning questions that you want to be able to ask Karen and her team here this evening before we wrap things up? In the meantime, we'll just give it a second here. I do want to make sure everyone knows we do have another session coming up on the 23rd, so watch for that coming up as well. And I am going to go ahead and we have a poll, just some questions to kind of let us know how helpful this was, If you, have suggestions, let me know, send me an email or send me something in the chat. But basically, we just want to get a little bit of feedback to see if this is kind of hitting the mark and answering your questions. So I'll go ahead and give you guys a minute to fill that out. Any other questions, Jennifer? Anything else come in?
Nope, no more questions at this time.
Okay. Okay, great. Well, I really want to thank Karen and Jen and Becky and the whole team for coming and visiting and answering these questions and giving this presentation. I will be, once I get that email from Karen with the slides, I will forward that out to everybody who has registered for this evening. And that way you can kind of take a look at that and had some information about those weekly sessions that are taking place, that if you have, run into trouble, that might be a good place to get some more information or have a chance to go through some more information. And just really appreciate everyone taking the time on this very cold night to take a little bit of time and learn a little bit more about the new processes that are coming through for this verification for services.
And Rhonda, I just want to request if the panelists and as well as the audiences are amenable, if they would like to participate in the provider support, they can share, if they are able to share their email with me. I do send out reminders, each week. And, so that would be great if you are able to. I will add it to, the email list so that I can send them out.
Okay, so maybe the best way to do that, if I have anyone who is interested in getting those emails from Jen with the reminders, go ahead and either put your contact information in the chat for myself or Jennifer, or you can email me at Rhonda Heights, Rhonda, RHONDA.Heights at unmc.edu. I can put that in the chat as well, just so that way you have that. And then we can get that information so that Jen can add that. Thank you for that.
Most welcome.
So the regulations do say that claims can be paid up to 180 days out. However, the additional, and I realize people are jumping off now, so I'm sorry. There's an additional piece of regulation that I didn't quite put my fingers on yet, that once you've submitted the claim and you're correcting it, you have a certain amount of time. And it's at least 30 days, but I can't remember off the top of my head. So thank you.
Okay, well, it looks like I'll give the poll just another couple minutes, but again, thank you everyone. So glad you could all join us, and look for flyers and information coming out for future sessions. I know we've got some more kind of in the works for the next couple of weeks, and towards the end of the month, and then looking towards the rest of the spring.